Hi, this is Dr. Gary Sykes, and this vlog is on the popular question, will I need to have a caesarean section delivery? Well, there's various reasons that we can detect before you go into labour. One would be your build. If you're unusually short or have an unusually shaped pelvis, that would mean that it's very difficult for a normal sized baby to fit through the birth canal. Then yes, that's an indication for a caesarean section. Another would be if you had a condition called placenta previa, the placenta was covering the cervix. Yes, certainly you need a caesarean section. If you have had a previous caesarean section for a reason that's likely to be relevant in your next pregnancy, such as you had an obstructed labour indicating that the pelvis was too small for a normal sized baby, then you certainly should have a caesarean section because you had increased risk of uterine rupture in labour. If your baby's lying in an unusual position, a transverse lie, that would need a caesarean section. If the baby's breech, historically the majority of babies that were presenting breech had the vaginal deliveries, but these days people are more risk adverse, and certainly a breech vaginal delivery is associated with far more risk than if your baby, if it is breech, is delivered by a caesarean section. So most women will opt for a caesarean section rather than a breech vaginal delivery. There could be concerns about baby's well-being before you go into labour, meaning that it's too risky, too dangerous for you to go into labour for the baby's sake, and a caesarean section. I recently had a lady where she had HELP syndrome, very severe, very severe preeclampsia, and it would have been extremely dangerous for her to go into labour. Indeed, she needed urgent delivery and under general anaesthetic because the platelet count was so low. So there's all sorts of other reasons as well, but certainly the majority of women who decide to have a vaginal delivery are successful in doing so and do not need to have a caesarean section. I hope that information helps and look forward to speaking to you again soon. Bye for now.